I'm going to bring you another piece of information that you can bring to your observerships, to your rotations in internal medicine, family medicine, pediatrics, and this is a very important topic: is asthma management. And as always, remind you that any management that you will bring up or to discuss has to be according to current guidelines. For the management of asthma, we use basically the GINA guidelines or the SMART guideline. So this one is an article that came on the American Family Physicians magazine on 2021 December, and it talks about the focus updates for 2020 and how this compares to the GINA guidelines. So let's dive into this super quick. So for you as an observer, if you want to make a quick presentation on this, I will say bring up the title of this being a focus update. Um, Start with the definition and diagnosis of each of the stage of asthma, and these are intermittent asthma being the lowest, then persistent asthma, which can be mild persistent or moderate persistent or severely persistent. And the next one will be as acute asthma exacerbations, which each of these one having a different treatment strategy. So the focus updates recommends that for intermittent asthma, we use as needed inhaled corticosteroids with short-acting beta agonist for children 6 to 11 years of age, and as needed inhaled corticosteroids and formoterol in adults. Um, so this is new for me. I am very much left on the practice of using only short-acting beta agonists for patients with intermittent asthma. So I would lie if I say that I knew that I have to use this combination on mild asthma. I think I was doing well with just short-acting. And for persistent asthma, the treatment option is the use of daily lows ICS with as needed short acting beta agonist or an as needed ICS with short acting beta agonist. Use one after the other for worsening asthma. Now, this is interesting because in the past we would use the ICS as a routine dose of twice a day. Now it's recommended to use it as needed ICS with short-acting beta agonist, the combination of these in one inhaler. For mild to moderate persistent asthma, they recommend the single maintenance and reliever therapy, also called SMART, which they report as prefer. And which one are the smart agents? We're talking about these ones that contain the combination of ICS and formoterol. An ICS being an inhaled corticosteroid, which can be mometasone or I don't remember the other one. One of them is mometasone and budesonide, and always with formoterol. So either or, mometasone, budesonide with formoterol. And with this approach, which is a new approach, being of better suitability for patients. Now, so the smart therapy seems to be something that is currently going around. The the treatment for acute asthma exacerbations will be with oral steroids and inhaled steroids. They discourage the practice of using only one or the other, and yep. So you have to take a look on this article. I think the way I will use this information is to create first the to bring up what are the definitions of asthma, and what are the current recommendations for each of them. For example, for intermittent, for persistent, based on the severity, for acute asthma exacerbations. That's it. And at the end, you can add that what is the current opinion on using allergen mitigation. Um, it is conditionally recommended. You can just add that. Immunotherapy. It is, what is conditionally recommended as an adjunct treatment for patients with mild to moderate allergic asthma who have demonstrated allergic sensitization and evidence of worsening asthma after exposure. So these two are kind of recommended. That's what conditionally recommended means. And fractional excretion of nitric oxide is not recommended or hasn't shown benefit. Bronchothermoplasty, a procedure that pulmonologists are offering to patients with asthma and is covered by insurance, and it's has shown some good results, is no longer recommended, as we don't have enough information of the long-term outcomes or the benefits, the extension of the benefits, the risk. So for this one, they recommend that patients should not have bronchothermoplasty performed because of its limited benefits. Long-acting muscarinics, we're talking about the LAVA, such as ipratropium, umeclidinium, tiotropium. So those are very common medications that we use in hospitals. We usually have tiotropium and ipratropium, and these ones are recommended. So that's the way I will use this. I will make a very short presentation of one page. Just bring up the definitions, bring up the treatments, bring up what is new, what you understand by smart therapy, and why do you think it is gaining popularity, and then a short discussion on the other therapies and how are these recommended or not. So that will be it for today. Thank you.